Cystic Fibrosis Foundation Compass presents Navigating CF, a series of informational videos for people with CF, their families, and caregivers. In this video, we take a look at Medicare's coverage for transplant. You'll find additional videos and more information in the Understanding Medicare series on the Navigating CF playlist. Navigating insurance during transplant can be especially challenging. Your costs will vary depending on how you receive your Medicare coverage. If you had Medicare before transplant surgery, Parts A and B cover organ procurement and the transplant surgery, as well as oxygen, necessary tests, labs, and exams before, during, and after surgery. Immunosuppressant drugs, follow-up care, and pulmonary rehab will also be covered. If you did not have Medicare at the time of surgery, then Medicare Part D will help with the cost of immunosuppressants. Be sure to check your plan's formulary. That's the list of prescription medications covered by your health insurance plan. It's helpful to know what Medicare pays for and what your financial responsibility may be for transplant. For example, Part A will cover your inpatient stay. Your cost share will be the Part A deductible and daily copay, depending on the length of stay. Part B will pay 80% of covered costs for the transplant procedure itself. You will be responsible for 20% cost share and any additional services that are not covered. This can add up. For this reason, most transplant programs will require that you have additional coverage. In other words, Medicare alone is not sufficient coverage for a transplant. You can learn more about specific coverage at medicare.gov. Medicare Advantage plans are private plans contracted with Medicare that include Part A, Part B, and often include Part D prescription drug coverage. Advantage plans have a yearly deductible and annual out-of-pocket maximum for Part A and B covered services. Once you reach a set out-of-pocket maximum for the year, the plan will pay for all covered services until the end of the year. If you have a Medicare Advantage plan, check your plan's network for the transplant center and transplant providers. The plan may not cover services received outside their network or out of state. And remember to check your plan's formulary for post-transplant medication coverage. You may need additional financial assistance resources to help with prescription costs. With so many financial variables, including coverage limits and out-of-pocket responsibility for deductibles and coinsurance, it's important to meet with the transplant facility's financial counselor. They can verify your specific coverage and determine your anticipated out-of-pocket costs for transplant-related care and chronic immunosuppressive therapy. This information can help you with your pre-transplant planning. There are programs that may be able to help pay for some of the transplant-related costs that Medicare does not cover. Medicare Extra Help, as well as the Medicare Savings programs available through state Medicaid offices, may be available to people with limited income and resources. If it's in your budget, a Medicare supplement policy, also known as a Medigap plan, can help pay some of your cost share. Keep in mind, though, that federal law does not require insurance companies to sell Medigap plans to people younger than 65 and on Social Security disability insurance, except under certain circumstances. This means that Medigap may not be an option where you live. You can find more information in the video called Managing the High Cost of Medicare with CF in this Understanding Medicare Navigating CF series. If you are dual eligible, meaning qualified in your state for both Medicaid and Medicare, most of your CF care, including transplant-related costs, will be covered as long as all of the providers accept Medicare and Medicaid. It's important to remember that Medicaid is managed by your state. If you go out of state for a transplant, that out-of-state provider may not be covered. Dealing with insurance during this time can feel especially overwhelming. But you're not alone. You'll find more information, support, and resources at cff.org/lung transplant. And connect with your care team and CF Foundation Compass when you need help concerning insurance and transplant.